This is the Good Dudes Grow 2.0. On the Good Dudes Grow 2.0, we're here to let you know the importance of plant-based medicine and psychedelics on mental and physical health. We're bringing you stories of how these medicines have changed lives and can save lives. We want to teach you the healing power of plant-based medicine. This is the Good Dudes Grow 2.0.
What's up, everybody? Welcome back to Good Dudes Grow. Today we have an incredible guest who's changing the game in mental health for veterans and first responders. Sam Peterson, a former Army EOD, which is, for most of you who don't know, an explosive ordnance disabled technician. He knows that firsthand the struggles that come with trauma, PTSD, and brain injuries. And after facing his own challenges, he's dedicated his life to developing innovative treatment programs that are helping hundreds of veterans and first responders. Sam, I appreciate you taking the time out of your day to talk to us a little bit. Give us a little background. And one of the biggest questions I'm sure I have is like, what would ever make you think about, becoming an EOD or play with explosives?
Well, the first thing was I wanted to get the hell out of where I grew up in Spokane, Washington. Growing up in a small town was not my thing. I wanted to get out of there. Plus, my dad actually had a really bad traumatic brain injury, so did not have the happiest childhood. And as any veterans, especially in the special operations community, are aware, it's the perfect place for misfit kids because we're just a bunch of BT male strippers with extra daddy issues and guns.
Oh, well, that kind of explains almost the same thing as firefighters. Like we become, what does we want to do? Let's break things and run into burning buildings because it seems like a good idea.
I like fires too. An explosion is nothing but a really, really fast fire.
So we got that in common. Well,
Yeah.
What personal experiences led you to start focusing on, besides your dad, on mental health and creating programs like Mind Spa and the Invictus Project?
Yeah. So, when I was in the military, that was one of the things they didn't really tell me about explosive ordnance disposal, is that it has one of the highest suicide rates of any job in the military. And that's because of all of the traumatic blasts that we eat on a pretty daily and weekly basis, just from all the demo operations, from dealing with improvised explosive devices. We're constantly exposed to those blast waves, and it has a really big negative impact on our brains. So, I struggled with PTSD when I got back, kind of developed a panic disorder, struggled with suicide. And then I had one of my mentors, and it was after I had gotten on the up and up and been introduced to some of these therapeutics that we now use in the clinic, that my life got on this really great trajectory, really started to come out of my deep, dark hole. And then 5 months after that, one of my mentors walked out into his backyard and shot himself in the head with his 3-year-old son in the house. And from that moment on, this became, my sole focus is how can we prevent some of the best people in our society from taking their own lives?
Yeah, the fire service, what didn't really prepare me either. Basically, I saw the fire service, I saw it was on TV, and I wanted to become a fireman, break down doors, go into burning buildings and stuff. But nobody ever told me about the suicide rates, the alcoholism, the chances of divorce, and all those things. So I understand where you're coming from there. You've worked closely with veterans and first responders dealing with PTSD and TBI injuries. What do you think the biggest challenges that you face when it comes to mental health care right now?
The biggest challenge is access to care, access to more effective care. Insurance companies don't like to cover things that are very effective. And the second thing is there is still a stigma, especially in the first responder and veteran community. We are so used to this traditional cycle of, hey, I'm going to hand you a pill and it's going to make you feel differently. It's not actually going to fix your problem, but we can just make it so you don't want to kill yourself. We're all too familiar with that method of treating mental health disorders. And honestly, it's not very effective. So I battle daily against that stigma to show people hey, you need to understand something. If you're struggling right now, you do not have to feel this way all the time. And then I, get to explain to them why their brain is going through the inflammatory process. And I'm like, okay, and we have some treatments that can actually help tamp down that that inflammatory process in the brain and help you feel better faster.
We always think these traditional treatments are the only way to actually go, because basically we listen to either other first responders or veterans, or we listen to our own doctors. Do you find that sometimes the doctors will actually contradict what you're saying, and you have that battle between each other, and that you need to educate a little bit more of the doctors? Because I know there's a huge, like, sometimes disconnect between the new treatments coming out compared to the old treatments.
That's we get into this idea that doctors get taught everything about medicine, and that's just not the case. They go through medical school, they get taught frameworks, they get taught traditional methods, and there's no part of med school that like teaches about nutrition, teaches about ketamine, teaches about off-label uses of different protocols. So there's a whole subset of the newest medical technology that most MDs don't know about, and they have to be educated on. So education is a huge part of what we do, and sometimes I do get into some fights with physicians.
Those are the best, because you're trying to. They always go fall back on their schooling, but you're tell them, but you didn't have the schooling for this, and they fall back on it. And it's like a tug of war. Sometimes it doesn't seem like it's going anywhere.
I just fall back to let's look at this from first principles, right? Like, why is it that the brain is having issues? Well, okay, cool. What are two things that anxiety, depression, PTSD, and TBI all have in common? They're two primary things. Is one, they're highly inflammatory to the brain. You really can't argue with me about that. It is in the medical literature. And two, they affect your brain's ability to talk to itself. Like, an underactive prefrontal cortex in the case of PTSD, and other disorders. So if we are really going to target our therapeutics to something that works, we should get to the root cause of the problem. And then I just bring up the STAR-D study, and anybody who doesn't know what the STAR-D study is, largest study ever done on antidepressant medications. It found that on their very, very best day, selective serotonin reuptake inhibitors, that's SSRIs for anybody who doesn't know the terminology, that's the mainline antidepressant. So on their very best day, our mainline antidepressants have a 33% chance of creating any clinical significant outcome for a patient. When you go to now, so someone, takes the SSRI, it doesn't work. You go to the second SSRI about 8 to 10 weeks later. That SSRI, statistically, according to this study, has a 25% chance of doing anything other than giving you side effects. Once we get to 3, that number drops to 16%. By the time we get down to the 4th trial of an antidepressant medication, that number is down at 6%. We don't do procedures in medicine with a 6% success rate. Someone might call that malpractice. And so I bring that up. And you know what the scary part is that the drug companies juiced those numbers, so they're actually lower. We should be concerned about that. We should also be concerned about the fact that saffron, like the spice, in 5 different randomized control trials was more effective than a selective serotonin reuptake inhibitor at treating major depressive disorder.
It's
like,
I mean, seriously, it's with all these new studies coming out. I keep saying, we got to figure out, studies are great, but let's put some stuff into action. Let's move the needle forward to where we're actually, we can create maybe even preventative ideas instead of actually reactive ideas where we're waiting till veterans or first responders get these symptoms. Because, from everything I've studied, everybody has different symptoms. Everybody does different things. It's not something you can see on an X-ray and say, okay, we need to put a cast on this, or you have the flu, we can need to take this. It comes from different stuff. So we need to not keep giving the same medicine for different symptoms.
Well, I definitely agree with that, Gary. But there are things that we can see depression on. There, if you do a quantitative EEG, you can see if the prefrontal cortex is overactive or underactive. Things like a SPECT scan. And a single computed image. I screwed up the acronym, but SPECT imaging. Like, you can see a traumatic brain injury on a SPECT image, or a reasonable facsimile of a traumatic brain injury on a SPECT image, because it shows you where the inflammation in the brain is. And from that, we can say, okay, cool, that part of the brain is not using energy optimally. Okay, cool. Let's target that. And so, I think you make a good point. We got to quit using 70s and 80s technology to treat things in 2025. We know this stuff works. Like, transcranial magnetic stimulation for depression, TMS, 75% efficacy at treating depression, at treating major depressive disorder. Like, come on, this should be a frontline therapy. It's not. We should be doing things that are the most effective and least invasive first. It's one of the primary axioms of medicine.
Exactly.
And it's not happening. We need to put pressure on these systems and say, hey, no, fuck this.
Exactly.
Let's do this better.
You guys are actually, and that would brings up to my next thing. You guys are actually leading cutting edge treatments. You said a few of them, but there's other stuff that you guys are looking for therapies and technologies. Are you not?
Yeah, absolutely. So what we found to be effective, and we do this in a number of the programs that I've founded, is a combination of four things. Is one, culturally competent talk therapy that kind of provides the blueprint for getting better. Two, ketamine infusion therapy downregulates inflammation in the brain, upregulates neuroplasticity, so it helps your brain create new connections. Hyperbaric oxygen therapy. Again, we're downregulating that inflammatory process in the brain, and we're hyperoxygenating the body and the brain. That allows your brain to create more cellular energy. So it makes this process of rewiring and healing go faster. And then, one of the other ones, transcranial magnetic stimulation, is an MRI coil that's inside of a helmet or a wand. And we can use that MRI coil to create a magnetic field inside the surface of the brain and upregulate the density of neurons in certain areas. Like I alluded to earlier, when we have like PTSD, you have an underactive prefrontal cortex and an overactive amygdala. Your prefrontal cortex doesn't have a large enough megaphone to shout down the older parts of your brain. So we strengthen that up so it can get louder and tell your amygdala to shut the hell up. And when you do all these things in concert, people get better so much faster. Like we're talking 14 to 17 days, full symptom remission. And the cool thing is they get better and they stay better. And after 45 days of doing the whole treatment protocol, we see an increase in executive function for PTSD patients is about 40%. So in 45 days, you could get an increase of 40% in your executive function. And then for our TBI patients, for those guys who are suffering from post-concussive migraines, brain fog, and those kinds of issues, we see upwards of 100% increase in their executive function after 45 days. Like, guys, this isn't rocket surgery. It's neuroscience, and it's not that hard.
It's all out there. And that's what dumbfounds me. Like, even everything that you said, if you took them and separated them, there's all studies on how well they work. And you guys are not doing, like you said, don't work like the 70s. You're not, this guy's not coming in, you're saying, okay, I'm depressed. Okay, let's give him RRSIs. You guys are actually doing quantitative diagnostics to make sure that the treatments you are giving them are actually benefiting, kind of like comprehensive blood work and blood panels to find out if it's not just the brain, but it could be something in the body is setting off the brain that's in inflammation, correct?
Yeah. So, being able to do diagnostics and see how the brain is functioning is really important. Right now we're getting into the EEG side of the house. We're in the process of buying a couple machines, but we do a lot with neuropsychiatric testing. So, hey, how is the brain functioning? What's your executive functioning levels at? How's your short-term memory? All that. And we're able to kind of see how the brain is functioning at different tasks. And that allows us to inform treatment along with, just the patient's heuristics. What's going on in their life? Were they a firefighter? Were they a combat vet? Were they around a bunch of explosions? Have they been exposed to toxic chemicals? We can put a pretty reasonable picture together of how that person has been operating in the world and, treat them accordingly.
Is there a powerful example or story that someone either or someone that you've helped that actually benefited, that maybe you thought like, you know what, I'm not 100% sure. I know this stuff works, but and it kind of really surprised you. I hate to use the word surprise because, like I said, you're doing all this quantitative stuff to actually make sure it does work. But like a story that you can tell somebody, like,
Yeah. So one of my good friends, Rich, this guy, and if anybody's listening who's a clinician, you'll understand this, especially someone in trauma therapy. Like, this dude fell off the trauma tree and he hit every single fucking branch on the way down with his face. Like, grew up in an abusive home. His mom was literally a whore. Like his dad was physically abusive, like former boxer with a TBI, beat the shit out of him all the time. He had a twin brother that he became estranged from who, went to jail. Absolutely, like almost starved to death as a child, awful, awful childhood. Goes into the Marine Corps, finally finds his people, gets family for the first time, gets deployed to Fallujah. On one of their like fourth or fifth missions, they're clearing the whole city. Kicks in a door. He's second man in the stack. His best friend Mike is in front of him. As soon as he kicks in the door, there's 17 dudes with AKs pointed straight at the door. His best friend lives long enough to turn around and push him out of the door, saves his life. He takes a bullet, and then got hit with an RPG. That's a rocket propelled grenade. Was just suffering big time. And we were able to put him through this protocol. And his level, when he originally came, and when I met him, I was like, "Hey man, you got to do this. Like, I don't care what it takes. Like, I'm going to save your life." And he was at the end of his rope when I first met him. And we were able to put him through this treatment protocol. And he came to us like anxiety and depression were maxed out, super, super severe, issues with cognitive function. And within 14 days, all of a sudden, all of the symptoms were gone. He went from super, super acute to no longer qualifying for the diagnosis based on our diagnostic tools. And, at that time, unemployed, was going through a nasty divorce with an awful human being. And, now on the other side of treatment, has a new fiance, has a job that he loves, doing cell work on towers, like lives up in the mountains on a horse ranch, and is absolutely crushing it at life. And that's all of that happened, over the course of like 9 months. So, you can really see that when you address the root cause of these injuries and you get people better, their lives get better too. And it happens really, really fast.
And that's the key to all these treatments, basically. It's not just to stop what's happening, but we want veterans, first responders to enjoy the rest of their livelihood. They gave so much to our communities and our countries and everything else. We don't want them to suffer the rest of their lives. They actually put themselves in danger and kind of suffered in the beginning. Let them enjoy now afterwards and when they're done, right?
Absolutely. I mean, it does not have to be, service and then continual sacrifice. We can heal these people.
Where do you see with the new psychedelics coming down? I know there's big talk with psilocybin, MDMA. Those are all the keywords that everybody's actually using around the neighborhood right now, trying to make sure that this is the magical pills and stuff. Where do you see this industry going with them? Is regulatory really going to screw it up like they've done with cannabis kind of stuff, or are we going to see something a little more, coherent that we can actually create better outcomes?
Yeah. So here in Colorado, psilocybin is legal. The framework for administering it in a clinic, I don't necessarily agree with, because there's a mandatory minimum 3-hour observation period, regardless of how much psilocybin you ingest. But we're getting there, and I do think that laws that are passed that really drive psychedelics into the clinical space is where we need to be. Because let's face it, psychedelic drugs are not for everyone. They have a ton of potential. They are very, very powerful tools, but powerful tools in the hands of amateurs gets people hurt. And these, MAPS and like the Beckley Foundation have done a ton of research and really have shown irrevocably that the set and setting matter tremendously. And doing that in a clinical space like here at our clinic is the safest way to do that. Having a full psychiatric workup to make sure there aren't any contraindications, to make sure this isn't going to cause a psychotic break in somebody, is really, really important. And being in a space where if you do go down the wrong rabbit hole and you end up in a bad spot, we have the ability to interdict with, something like a benzo, which can slow down and put the brakes on one of those experiences. So, I think we're moving in the right direction. I would like to see, in Colorado, we can't really do microdosing based on how the law's written. It just doesn't make sense. So I would like to see, a little more fine tuning based on dose, because I do think that there's a lot of benefits to using psilocybin in particular for microdosing. I think the research is going to come out in the next couple of years that using whole mushroom microdosing is going to be far, far more effective than anything the pharmaceutical industry has put forth as an antidepressant medication. And that's where I see like a big shift happening, especially over the long term, is moving away from these monoamine approaches to targeting mental health disorders and going to, okay, let's increase neuroplasticity and then pair that with culturally competent talk therapy. So cool. We've increased your brain's ability to create new synaptic connections. Now let's drive that forward into a positive space.
We're both on the parallel same thing that we see for the horizon. I think the outcome of what we're going to find out about microdosing and being able with the neuroplasticity and creating, those outcomes for long term might even be able to differentiate the journey wise to where the acute people, like the really, people are having major issues, maybe need the bigger dosages and slowly go to microdosing, where some maybe even start with preventative, where they can microdose throughout their career and never end up developing maybe this type of style of symptoms later on down the road.
Oh yeah, totally. You really have to tailor your tools to what the patient is going through. And that's what we do here. It works really, really well. We just have to be careful that psychedelics don't fall into this magic pill category, because they're not.
Right.
There is inherent risk. Neuroplasticity, I've said that word a lot. It is a double-edged sword. You are increasing your brain's ability to make connections. Those connections can either be good or they can be bad. So it needs to be, really, the medicine needs to be respected. We need to realize that this is a powerful intervention, and that if we don't do this right, could hurt people. We can also do a lot of good.
Right.
But it's all about administration,
Yeah, exactly. I've heard stories of people thinking that it is the magical pill, and they go to places like Costa Rica and Mexico, and what they end up doing is that they keep going back and back and back, and they're not literally figuring out exactly what they're supposed to be doing. They just think that sooner or later it's going to change them, and actually it changes them for the worse, and they go down these terrible paths, which are not good. And like you said, it should be in a controlled setting, medical setting, have professionals around you so that we can guide you in the proper area.
Yeah. And have a proper workup beforehand. Cause it's one of the, and I'm a huge, we got to preface this. I'm a huge advocate for psychedelics, for all the work that Heroic Hearts Project is doing with veterans to go get ayahuasca, 5-MeO, DMT, and those sorts of things. But we really need to be careful when it comes to psychedelics and traumatic brain injuries. So, I don't know if your viewers know this, but one of the things that psychedelic drugs like psilocybin and LSD do is they increase the amount of electrical output that your neurons are producing by several factors. So when you do that and you have a TBI, you're basically trying to pass a ton of electricity through a short in the system because of that inflammation, because of that lack of connectivity that's happening in the brain from a traumatic brain injury. If you do that, you are putting someone on an express lane trip to a dissociative panic attack. And that's exactly like the harm side of the fence that we need to be watching for.
Great point. Do you see a big stigma for within the first responders or veteran community themselves about using these compounds themselves? I know we talked about it a little bit more, but do you see some fighting within the communities themselves? Like, we're not sure, or they still have the stigma? Is there a big battle there, or are they more open?
So it depends on, I can't put all first responders in the same bucket.
Right.
Typically fire and EMS, they're like, right on, we're good to go. They're all about it. They tend to embrace it a lot more. There's quite a bit more pushback on the police side. They're concerned with, hey, if I take this drug and then I go on patrol the next day and I have to, use my firearm, are there going to be unintended consequences from me being administered that drug? So that's a huge reticence from the police side. The VA and the DOD are still like, the VA's come around to ketamine finally. The DOD still hasn't, which that working on that one. Just if Secretary Hegseth ever listens to this, let's have a chat. We need to fix this.
I'll tag him when I put the post up.
Yeah, tag. Hey, I'm wearing the same pocket square. Mine's just green. Yeah, so I'm seeing these guys. I'm seeing, especially here in the state of Colorado, people are coming around to it. They're seeing the results. And one of the things that we tell them is, hey, there's no such thing as a magic pill. We use this in combination with other therapies. Because just ketamine, for instance, ketamine will give you a taste of what you could feel like all the time, especially if you've been dealing with chronic PTSD or TBI. All of a sudden that downregulation and inflammation happens. Boom, you feel better, but it only lasts for, probably 2 months if you don't do anything else. But if you add in the hyperbaric oxygen therapy and the TMS, you can create that synergistic effect and not only get them better faster, but keep them better longer.
Perfect. So if people wanted to reach out or learn a little bit more about what your companies are doing, how would they get involved, or can they help you progress to get more access for veterans and first responders?
Yeah, so the easiest way to get in contact with us is to check out our website, mindspadenver.com, or shoot us an email, info@mindspadenver.com, or give us a call. And the phone number for our clinic is 303-327-0350.
Perfect. I also have all that in the show notes. Sam, I appreciate you taking the time out of your day for having this quick conversation, and I'm looking forward to staying in touch and having more conversations later.
Absolutely. Thanks, Gary. Appreciate you having me on the pod.
You have yourself a great week.
You too.
If you're still listening to this, that means you gained some type of value. So what we need you to do is leave a review and make sure you subscribe so you never miss an episode of The Good Dudes Grow.